I'm here today to talk to you about World Stroke Day. What is it? Why is it so important? And what should we do about it? We here believe so very many of the strokes are preventable. So therefore, I say they're really no accident. World Stroke Day is an opportunity to understand your risks, to intervene, and to either prevent a stroke or to minimize the damage from a stroke. More than 795,000 people in the United States have a stroke. About 610,000 are their very first or new strokes. And about 130,000 Americans die every year from a stroke. One American dies of a stroke every 4 minutes. And strokes are the fifth leading cause of disability in the United States. And they're the leading cause of long-term disabilities. Strokes can occur at any age, and 34% of people under the age of 65 have strokes. The key to strokes is prevention. If we can alter our lifestyle and prevent a stroke, it's so much easier than trying to fix it after you do have a stroke, because it can be very disabling. And how we talk about stroke prevention is to stay active, to exercise, to eat a healthy diet, low in fat and salt and sugars, to either don't smoke or stop smoking, to reduce your stress, and also know your numbers of your blood pressure, your cholesterol, and A1C. Talk to your healthcare provider about it and work towards a goal. Go to your healthcare provider regularly and don't consume alcohol excessively. These simple lifestyle modifications can make a difference in your outcome, whether you have a stroke to minimize the damage or to prevent a stroke. It's also healthy behaviors for other disease processes. No one body system works solely on its own. Everything is interrelated. We all need to stay active, and what I mean is exercising 5 days a week for at least 30 minutes a day. And it could be as simple as walking, running, bicycling. You could take the stairs during your lunchtime or try walking at lunchtime. You don't have to be at work to do these things. You need to prioritize and make time to keep yourself healthy. If you do work for a bigger company, many of them have healthcare initiatives that you can join and earn points to reduce the cost of your health insurance. And a lot of them are team oriented. They give you a wealth of information. They help you understand your health risks, and they work towards improving your health overall. For every hour of regular exercise you get, you'll gain about 2 hours of additional life expectancy, even if you don't start till middle age. It's never too late. Just 2 flights of stairs every day could result in a weight loss of about 6 pounds a year. It's important that we all eat healthy. The Mediterranean diet is the diet most suggested by many healthcare providers. What it does is it alters your LDL and your HDL levels, which are the good and the bad cholesterol. So many of us have our levels that are skewed. The LDL is supposed to be low and many have high results. And the HDL is supposed to be high and many have low results. By cooking with olive oil and going to the Mediterranean diet, that can help change it. We also have to practice portion control, not to overeat. Eat fresh or frozen vegetables. They're more likely to be very low in sodium or no salt. It's important that we all watch the salt. Salt is salt. Sea salt is no better than any other type of salt. I don't know if you're aware, but many supermarkets have a nutritionist associated with them, and they're a free service. Inquire whether your local supermarket has a nutritionist. If so, make an appointment, bring a pad and pencil, and go in and speak to the nutritionist about healthy choices for your diet. Many times when we get on special diets, we get sick of eating the same things over and over. Nutritionists can be very helpful in food selection, suggestions, and even snack suggestions. Stress can also increase your risk for high blood pressure, stroke, or a heart attack. It does this by releasing powerful chemicals within your bloodstream that increase your heart rate, your blood pressure. It interferes with your sleep. It interferes with your appetite, either by increasing it or decreasing it. It can raise your blood sugar, and it can alter your mood, making you angry, upset, moody, depressed, irritable. All of these things make everyone feel uncomfortable, on edge. So practice some simple stress reduction. Things like taking time for yourself every day, perhaps practicing mindfulness or listening to music, reading, doing something that you like to do, that you get some joy out of. Socialize with others. It's not good to be isolated. People need each other. Many practice yoga, and exercise definitely helps your mood and releases endorphins and makes you feel so much better. Stress actually depresses your immune system and affects your digestive system. Everyone talks about smoking cessation, and there's a good reason for it. Research has proven that smoking is related to heart attacks and strokes. I like to tell everybody the more you smoke, the more you stroke. 1 out of 5 deaths from heart disease is related to smoking, and smoking places you at 2 to 4 times the risk of a stroke. Within those cigarettes, there are toxic chemicals that actually harm and alter your blood cells. They decrease the flexibility of all the arteries within your body, and it leads up to a presentation of plaque. And plaque actually narrows your arteries and puts you at risk for a stroke, high blood pressure, and a heart attack. It increases the clot formation. Smoking lowers your HDL, which should be high, not low, and it increases your blood pressure and heart rate. It deprives every single organ of your body of oxygen. Just so you know, smokers have 30 to 40% higher risk for diabetes and increased risk for cataracts. Looking at smokeless tobacco is not a better option. In fact, many times is worse. E-cigarettes, hookah, and vaping are just as destructive in other ways. All of these increase your risk for heart disease and a stroke. We endorse the Quit Center for Smoking Cessation. It's a free service that helps people try to stop smoking. On average, people try to quit smoking 5 to 7 times before they stop. And research shows that people are 4 times more likely to succeed when they are participating in a structured program, like a group program. The Quit Center caters to all ages, genders, and races and ethnicities. It's all over New Jersey. And what they do is they help you establish a realistic quit date and provide support. If you're not ready to stop smoking, they also have groups that you can talk to other people about. It provides information on and individualized recommendations on using prescription, non-prescription smoking medications and strategies. You could connect on one-on-one or in a group session. And with COVID, the Delta variant rampant, many of this is done virtually, so you don't even have to leave your home. Cholesterol plays a big role in strokes. To understand cholesterol, we need to understand the different parts of cholesterol, what it means. The HDL, the high-density lipids, otherwise known as the good cholesterol, higher is so much better. The optimal readings for men are over 40 and women under 50. It's important to understand what the numbers mean when your doctor talks to you about the cholesterol. Just don't look at the overall number, look at the breakdown and see how it affects you. The LDL, or the low-density lipids, or the bad cholesterol, lower is better. It depends on what your health history is to depend on what number you should be advised as a goal. People with heart disease or diabetes, their goal should be under 100. Many healthcare providers tell patients that their goal really should be under 70. Please remember that all this is individualized to you. 2 or more risk factors, you should have an LDL under 130 or perhaps even under 100, depending on what your healthcare provider tells you. And if you don't have any risk factors or only one, they may tell you that your goal is under 160. It's important for you to understand that everything should be individualized to you because you're in charge of your health. Triglycerides vary by age and sex. Traditionally, under 150 is optimal. Things that lead to elevated cholesterol is physical inactivity, cigarette smoking, a diet high in carbohydrates, or excessive alcohol consumption. If you think about it, high triglycerides and a low HDL or a high LDL is associated with atherosclerosis. And what that means is that's the fatty deposits in your artery walls. It decreases the blood flow through your arteries. It makes it more brittle and inflexible, and it puts you at risk for a heart attack and a stroke. The blood sugar is another aspect to look at when we talk about stroke prevention. What is an A1C and what does it mean? An A1C is a measurement of your blood sugar over a 3-month period of time. Now, if you take a look at the clipboard up on the screen, there are a description of the different values and what they mean. 5.7 to 6.4 means that you're at risk to be a diabetic. And if it's 6.5 or higher, you probably have diabetes. Many people do, and they don't even realize it. And if you are a diabetic, your goal should be under 7. Now, why is it important that the blood sugar be controlled? We don't want the blood sugar to be too high or too low, because elevated blood sugars act as a toxin within your body and can damage many organ systems: your eyes, your heart, your kidneys, your brain. People lose limbs and toes from chronically elevated blood sugar. So let's take charge of our blood sugar. If you are a diabetic, take your blood sugar and keep a log of it. Visit your healthcare provider regularly. There are many different options on how to measure your blood sugar, and that's an individual choice that you should talk to about with your healthcare provider. Blood pressure is another thing that we need to consider for stroke and heart attack. When you look at the numbers up on the screen, the numbers seem so low. But the intent of the American Heart Association, as well as the American Stroke Association, is to target your blood pressure early for prevention. So a normal blood pressure is considered less than 120/80. It becomes elevated when it's 120 to 129/80. Now, high blood pressure is now in 2 different categories: stage 1 and stage 2. Stage 1 is where we recommend lifestyle modifications. And that would be if your blood pressure is between 130 to 139/80 to 89. And the lifestyle modifications could be weight reduction, smoking cessation, a diet like a DASH diet, a Mediterranean diet, low sodium, low cholesterol, decreasing your alcohol consumption, and exercising. None of these things are what we consider happy things to do, but we need to invest in ourselves. We need to treat ourselves and our bodies with respect. Now, high blood pressure stage 2 is 140/90, and that's when you'll hear about medications being introduced. If you can make lifestyle modifications and make a change prior to medication being introduced, it's so much better for you. We need to target your blood pressure to keep everyone healthy. If you do go on medication, we need to think about it responsibly. You need to take your medications as prescribed. I suggest getting a blood pressure machine and keeping a log of your blood pressure. Always take your blood pressure in the same arm. If you're newly starting a medication, I suggest that you take your blood pressure 3 times a week. Once in the morning, once in the afternoon, and once in the evening. Write the blood pressure down, the date, If you have any symptoms, it's important that we realize how your medication is working. Is it the right medication for you? Is it the right dose for you? If you're established on a blood pressure medication, talk to your healthcare provider about how frequently you should be taking it. Know what your goal is. If you're off goal, or if you have symptoms that you don't feel well, call your healthcare provider. Make an appointment, go in and talk to them. Bring your blood pressure log in. If you're having side effects, call your healthcare provider right away to discuss those side effects. Because not all medications are right for every single person. Alcohol is something that we should consider when we talk about stroke prevention. It's fine for healthy people to drink no more than 2 drinks a day, or no more than 4 drinks at any occasion. Where we get into trouble is when people drink excessively. Now, we could break this down into different categories such as spirits, beer, or wine. Now, the recommended portions of spirits with 40% alcohol is 30 milliliters or 1 ounce. With beer, it's 9.6 ounces or 1.1 drink. And wine or champagne is 3.3 ounces. Keep in mind that most restaurants serve over the recommended portion. Why is alcohol so important to think about when we talk about stroke prevention? Well, it raises your blood pressure and it increases the risk for an abnormal heart rhythm such as atrial fibrillation. It increases your risk for diabetes. It also depletes your body of vitamins and minerals that it needs to function properly. It could interfere with blood clotting, and it does interfere with so many different medications. Now's the time that we talk about risk factors. What are they? What can we do? Is it possible that we could change everything? No. Up on the screen, I have modifiable and non-modifiable risk factors. Modifiable means things that you can change or alter, and non-modifiable risk factors are fixed factors that you can't change. The modifiable ones include high blood pressure. You can change that. Diet, exercise, maybe even medication. Okay. High cholesterol, diet, exercise, maybe even medication. Diabetes, keep control of your blood sugar, keep a log, keep your A1C within realm. Atrial fibrillation, if you have chest pain, palpitations, let your doctor know right away. You might be having a rhythm problem. Many people have atrial fibrillation, don't even realize it. Peripheral vascular disease, or poor circulation in your distal extremities. Many people experience pain in their legs when walking. Notify your doctor of any symptom that you may have that's out of the ordinary or that limits your capacity to function in your daily life. Carotid artery disease, how do you know you have it? Many health fairs do carotid artery screenings for you. I suggest that you take advantage of it when you can, and you can bring the results to your healthcare provider. As we said before, smoking increases your risk, and you can change that too. It's not easy, but you can do it. Illegal drug use also promotes strokes and heart attacks, excessive alcohol intake, excessive weight, as well as inactivity. These are all things that you can change yourself. It's not easy. It's not pleasant, but it will be worth the effort. The non-modifiable risk factors include your gender, your race, your family history. Family history is associated with an increased risk for many diseases. A history of a prior stroke, a prior heart attack, any blood coagulation disorders, and even sickle cell anemia. I want you to think about being proactive in your health. Learn about all the conditions that you have. Be the expert in your health conditions. And I want you to talk to your healthcare provider about your individual health profile. What can you do to maximize your health? Maintain your daily function. Strokes rob people of so many things that we all take for granted. Going out with friends and family, walking, taking care of ourselves, speaking, driving. There's so many things strokes interfere with. If we could prevent it, that would be optimal. So when you go to your healthcare provider, make a book, make a list of your blood pressures, your medications, your blood sugars. Write everything down because it's easy to forget from week to week or even day to day what the healthcare provider said. If you have questions, write them down too and leave space for the answers. It's important that you participate in your healthcare and understand what's going on. Why are these things recommended and what will they do for you? Will they improve your outcome? It's important for you to know that you're in charge of your body. I want you to become engaged in your health and to have a better outcome. I would be remiss if I didn't go over the signs and symptoms of a stroke. And I want to emphasize that should you have any signs or symptoms of a stroke, to call 911 immediately so that it could be rapidly identified and perhaps we can intervene and either stop the stroke or even abort the stroke. Because we want to help you stay healthy. Now, the symptoms are what I call B fast. It's a sudden onset of symptoms that you have not had before. And B stands for balance, if all of a sudden you're off balance or leaning to one side. E is eyesight, double vision, blurry vision, or where you can't see out of one or both of your eyes. F is a facial droop, or when you go to drink something, it comes out the other side of your mouth. A is an arm or leg only on one side, numb, tingly, you can't feel it. S is speech, where it sounds funny or you're saying the wrong word. And T is time to activate 911 immediately. We have a very short window of opportunity to stop a stroke, 3.5 to 4 hours to stop a stroke, to intervene, to make a difference in your life. Let's all think about preventing a stroke, identifying a stroke early. I want everyone to understand what it means to their health. Be healthy, be happy, and take care of each other. Talk about it with your family. Everyone is at risk for a stroke if you have risk factors. And the more risk factors, the higher your risk. Should you have any questions, feel free to email me. My email is at the last slide below. I wish everyone a happy and healthy month. And I want everyone to remember World Stroke Day to me is every day. Thank you and have a good day.